the program where science meets compassion, where myths give way to medicine, and where your health is always our first priority. Just a reminder, we're live on Facebook and the CNC3 website with reruns on Fridays at 11 a.m. or Saturday at 11:30 a.m. And don't forget to like our Ask the Doctor page and follow my articles in Friday's Trinidad Guardian, as well as a new We Health segment every Tuesday where your burning questions will be answered. Whether your concern is large or small, your health matters, because every healthier person helps build a healthier family, a healthier community, and ultimately a healthier nation. Let's start with the doctor's capsule. Tuberculosis, or TB, may seem like a disease of the past, but a new study from England is a timely reminder that it remains a serious public health challenge. Researchers looked at more than 72,000 TB cases and found that almost one person every week was diagnosed with tuberculosis only after they had died. So the people most at risk of a missed diagnosis were older adults, men, people born in the United Kingdom, those with a history of drug or alcohol misuse. TB, affecting organs outside the lungs, like the brain or the kidneys, was also more likely to be overlooked because it could be much harder to recognize. And the important message is that TB is usually curable with antibiotics when diagnosed early. If you have a persistent cough lasting more than 3 weeks, unexplained weight loss, fever, night sweats, if you're coughing up blood, those are red flags which should never be ignored, particularly in people with risk factors such as suppressed immunities, including diabetes. Now, although we may have a lower burden of TB than many parts of the world, the disease has certainly not disappeared. And in fact, since COVID, we've seen a rise. The study reminds both doctors and the public to keep TB in mind, because early diagnosis not only saves lives, but also helps prevent the infection from spreading to others. It's a reminder sometimes the diseases we least expect are the ones we should never forget. Further afield, if you spend most of your workday sitting at a desk, here's some encouraging news. Just a 5-minute walk every hour, so right around the office, may be enough to improve your mood, boost your concentration, and reduce fatigue. Researchers from the US studied more than 11,000 office workers and compared different walking schedules during the workday. They found that a 5-minute walk every hour was the most practical and effective approach. So walking every 30 minutes, just taking that brief break, offered benefits, but it was more disruptive, while walking every 2 hours was less effective. So take a break every hour, at least for 5 minutes. Because researchers also found that these short movement snacks improved alertness, memory, and overall well-being without impacting on productivity. In fact, many participants felt they worked better after getting up and moving. And I think it may be applicable to our students in the midst of exams. Take a break, 5 minutes. The message is simple. Our bodies were designed to move, not to sit for hours at a time. So whether it's a short walk, pacing while you're on the phone, or holding a walking meeting, these small bursts of movement will translate into big differences. So if you're working at a desk today, here's a prescription. Stand up, stretch those legs, take a 5-minute walk every hour. Your body, and maybe even your boss, may thank you for it. It's graduation time, and I know that students are waiting results for the SEA. Some are in the midst of end-of-term tests. And last week, I had the privilege of speaking at the graduation ceremony of the Upper Karapichaima Presbyterian Primary School. And as I looked out across a hall filled with children in graduation gowns, I realized something. And it's applicable to SEA. Graduation isn't really about certificates. It's about possibility. We spend a lot of time asking children what they want to be when they grow up. A doctor, a teacher, an engineer, a lawyer. Perhaps there's a better question. What kind of person do you want to become? Because long after those job titles are forgotten, character remains. You know, I've sometimes care for people from various walks of life, and one lesson has stayed with me. Patients very rarely remember how much you know. They remember whether you listened, whether you were kind, whether you gave them hope when they needed it most. And it's the same truth in life. Real change doesn't always come from famous people making headlines. More often, it comes from ordinary people doing ordinary things with extraordinary compassion. Think about a teacher who stays after school to help students, a neighbor checking on someone who lives alone. A nurse will want to give a reassuring smile to a frightened patient, or a parent making sacrifices that no one else ever sees. Now, you're not going to see those moments on the evening news, but those are the moments that shape families, communities, and nations. And if we really want to change the world, and the theme for the graduation was Be the Change, perhaps we don't need to begin with grand gestures. We begin by choosing kindness, integrity, and curiosity every single day. Revolutions don't always start with crowds. Sometimes that quiet revolution begins with one good person deciding to do the right thing. And for Trinidad and Tobago and the rest of the world, it's certainly a revolution worth believing in. It's time for a short break, and when we return, the Kiddies Capsule is up next.
Passad's D-Food King with a mega month-end deals. Big savings on Sundays ice cream assorted 3.8 liters, 2 for only $99. Coca-Cola soft drink 2 liters, 2 bottles, now only $18. Aqua Pure Water only $14.99 per case. Bezla mac and cheese 5 packs, now only $20. Clean and white bleach 3.8 liters, now only $30. Catelli tomato ketchup 750 ml 4 packs for just $20. Cotoneer paper towel XL 220 sheets, 2 rolls for just $28. Swiss pasta cups assorted 4 packs, now only $18. Don't wait, shop and score big on your everyday essentials at Passad's D-Food King. Offer ends July 8th or while stocks last.
Quality value, that's our way. A real Passad's, we're here to stay. The Food King Passad's.
Lucozade, bring the energy. Unbeatable taste, new look.
In every room, Vision sets the standard. For a limited time only, get your progressive transition lenses with an anti-reflective coating, designer frames, and eye exams. Starting at $16.50, only at Seaview Optical. Affordable eye care for everyone.
The detergent smells nice while washing, but when you use the new Downy Intense fabric softener, with its new multi-capsule fragrance, it releases an intense scent that lasts twice as long. With the new Downy Intense, you'll enjoy a rich and delightful fragrance that keeps you feeling fresh 24/7.
Things don't always go as expected. Be ready with Trinry for auto, home, business and group life. Call us at 800-TRIN or visit trinry.com today. Huge insurance premium. Pay your premiums bit by bit with FlexiPay from Trinry. For more manageable auto, home and commercial insurance payments, call us at 800-TRIN or visit trinry.com today. Trinry. Premier insurance coverage for less.
Welcome back to CNC3's Ask the Doctor. Did you know that your heart has already beaten millions of times? Your brain is more powerful than any supercomputer, and your body is busy doing incredible things even while you're sleeping? So put on your thinking caps, bring your biggest smiles, and let's discover something amazing together. Because every great doctor, every great inventor, and every great scientist started with one simple word: why? Let's have a look at this evening's Kiddies Capsule.
Good evening. Today, June 25th, is actually World Vitiligo Day. Vitiligo is a long-term autoimmune skin condition that occurs when the cells responsible for producing skin pigment known as melanocytes are lost or simply unable to function. While vitiligo is not painful, contagious, or life-threatening, it can still significantly impact an individual's emotional well-being and self-confidence. The condition impacts millions of people worldwide, regardless of age, gender, or ethnicity. Some of the greatest, most inspiring individuals to date have lived with vitiligo, including Michael Jackson, Winnie Harlow, Martha Stewart, and my best friend, Kalika German. By raising awareness and encouraging acceptance, we can ensure that everyone feels seen, valued, and comfortable in their own skin. I'm Abigail Prudhomme from Saraswati Girls Hindu College, and this was your Kiddies Capsule. Bye!
June 21st marks the International Day of Yoga, a global reminder to slow the body and steady the mind in a world that never stops moving. Yoga isn't just stretching on a mat, it's a full reset for how we breathe, think, and handle stress. From students under pressure to adults juggling non-stop responsibilities, this practice meets people at every age and every level. This day highlights how small moments of movement and breath can build real mental and physical strength over time. So whether it's a 5 minutes or 50, roll out the mat, breathe deeper, and reconnect with yourself. I am Gabriella Singh of Saraswati Girls Hindu College, and this is your Kiddies Capsule.
And we say a special thank you to all involved with this fan favorite segment, always a treasure trove of information. We'd love to hear from school-aged children discussing similar health-related themes. Feel free to send videos to 800 CNC3. Have a chat first with Uncle Rajiv, the producer of the show. Now it's time for a short break, and when we return, the Medical Minds segment awaits.
Panadol's new formula, 5 times faster than other paracetamol brands. There's no time to waste during special moments. When I need fast pain relief, I choose Panadol Rapid. With its new formula and exclusive technology, it's 5 times faster than other paracetamol, giving me effective pain relief. And it's also gentle on my stomach. Because my greatest gift is giving them special moments.
Magical Expressions Limited is the largest local importer and distributor of fresh cut stems, offering the widest range of beautiful flowers at the most affordable prices. Call us today at 701-6488 or visit our website to order.
Love eating spicy food, but soon after, that familiar discomfort begins. Heartburn, acid reflux, and bloating. Introducing Peptica Gel, formulated with aluminum hydroxide, magnesium hydroxide, and simethicone to help neutralize excess acid. It's sugar-free with no chalky aftertaste and a pleasant orange flavor. Peptica Gel works fast to relieve heartburn, acid reflux, gas, and bloating, so you can feel comfortable again and get back to enjoying life. Peptica Gel, get the relief you need today. Available at pharmacies nationwide.
At Cruise Inn Hotel and Yachting Center, we're all about time. In fact, once you check in, there's no time to lose. Reconnect with a little family time. Make a splash with some pool time. Spend some treasured quality time. Or just immerse yourself in some quiet time. Indulge your senses at dinner time. We even have the perfect venue when it's your celebration time. So it's high time you visit Cruise Inn. Choose our day pass or call 607-4000 to make your dinner or hotel reservations or to find out more about our event spaces. Take a time out at Cruising Hotel and Yachting Center.
In every room, Vision sets the standard. For a limited time only, get your progressive transition lenses with an anti-reflective coating, designer frames, and eye exams. Starting at $16.50, only at Seaview Optical. Affordable eye care for everyone.
So CTA is saying that they're doing the ABC of parenting, so I say I have to get in that. You know, anything with the ABCs, I like to get in that. I started with A for accountability. So you just mash up thing from a side when you get vexed, and then you surprised when you get called into the school for your child doing the same thing. Recognize that as a parent, you are one of the biggest influencers on your child's life. You have to acknowledge that your actions and choices can impact your child's development and growth. Take time to account for any consequences your actions may have on your child, and always acknowledge that responsibility before saying or doing anything. Your actions speak louder than your words, but at the end of the day, do your best. Share if you found this useful, and like and follow CTA's profile for more parenting tips as we go through the ABCs of parenting.
Welcome back to the #1 show for news, views and interviews of all things medical. June is Men's Health Month, but yet many men would rather discuss politics, World Cup football or the price of doubles than discuss their own health. A surprising number can tell you when their vehicle was last serviced, but cannot remember when last they checked their blood pressure. Now, why do men delay seeking medical care? What health issues are being missed? And how can fathers, husbands, sons and brothers take better care of themselves? It's time to shine the spotlight on men's health. And joining us this evening is consultant urologist and my fellow lecturer at the University of the West Indies, Dr. Satyendra Prasad, for an important conversation about men's health. He's no stranger to the Medical Minds segment, and we say a special welcome in this evening's Medical Minds.
Hi, good evening. It's Men's Health Month, and I thought we could discuss some of the common health issues I see affecting men in my field. First of all, there's prostate cancer. Now, Trinidad has, and the Caribbean at large, has some of the highest mortality rates of prostate cancer anywhere in the world. And yet, despite this, we don't see enough men getting screened. Now, screening could save your life because we have a lot of treatment options available locally, including surgery or different forms of radiotherapy and even focal therapy. Now, once prostate cancer spreads outside of the prostate, it becomes difficult to treat. So I urge you to get screened early, and in the past we used to recommend a rectal examination as well as the PSA blood test. We've changed that somewhat to make the rectal examination optional. You don't have to come and get a rectal examination done. You can just come and do a blood test, and that blood test could save your life. So I urge you, if you're over 40, Afro-Trinidadian over 40, or for other men perhaps over 50, and if you have, especially if you have a family history, I urge you to get screened for prostate cancer today. The second thing we need to destigmatize is erectile dysfunction. Now, it's quite common, especially with our high incidence of chronic diseases such as diabetes and high blood pressure. And what I want men to take home is that what's happening, erectile dysfunction is a blood flow issue. And what's happening in the small vessels in the pelvis is happening elsewhere. So especially for young men with ED, they need to be careful that the same process is not happening in their heart. So if you have ED and you're in your 40s, for instance, you should have that checked out. And there are multiple treatment options. Your urologist will check your other things that could potentially be an underlying issue with erectile dysfunction, such as your cholesterol, diabetes, and these things. The other thing is blood in your urine. Blood in your urine should never be ignored. Especially gross hematuria, which is what we call blood in the urine, and microscopic hematuria, especially if you're a smoker, you have risk factors. That should be elevated further. It shouldn't just be treated with antibiotics. So if you have blood in your urine, you should see a urologist. If you have difficulty passing urine, slow flow, you don't feel like you're emptying your urine properly, you have to go every 5 minutes, or you're waking up several times at night to pass urine. That could be signs of not just prostate cancer, but that could be a sign of, or those could be signs of an enlarged prostate, which is very treatable. We have many treatment options locally, including medical and surgical options. So men need not suffer in silence. And the final thing I want to talk about, one of the things we need to destigmatize the most is mental health. It's okay to not be okay. We have so many stresses in life these days, and men should not be afraid to seek help. We have a lot on our shoulders, and if you're feeling stressed out or you're feeling like it's very difficult to cope, I'm here to tell you that it's okay to ask for help. You know, that's not a sign of weakness at all. And I believe Dr. Tilak Singh mentioned this in his column this week, that is in no way, shape, or form. It's actually a sign of strength to recognize that you're having difficulty coping and you need to ask for help. Thank you.
And we say a special thank you to Dr. Sati Prasad for his love, service and support to the country and indeed the region in urology. And just to emphasize particularly the latter part of his discourse about mental health in men and the stigma that tends to surround the specter of mental health. It's almost like a shadow pandemic. It's been exacerbated since COVID, and some of the clinical features may include problems sleeping, a reduced appetite or a change in appetite, a reduced level of concentration, a loss of interest or zeal in things that used to afford pleasure, feelings of hopelessness, helplessness, or worthlessness, reduced memory, low self-esteem, and even suicidal thoughts. There is help available. Present yourself to the nearest emergency room if you wish. Seek out help from friends, family members, religious leaders, someone whom you trust, and the medical fraternity is always waiting to assist. It's time to put your medical knowledge to the test, and our wonderful audience members are ready to take on the challenge. There are 2 giveaway segments coming up next.
Period nights don't have to look like this. Move less, wake up to change. So change for a real night's sleep with Always Overnight. Its 3 times protection system absorbs, locks the fluid, and keeps it away from your skin. For protected nights without leaks. Always.
Visit Tire Clinic Marketing, New Truck and OTR Tire Service Center at number 30 and 32 Montrose Main Road, Chabonas. Call today at 665-8973 or 672-3419. Alignment services available. Tire Clinic Marketing, Truck and OTR Service Center. A tire for every need.
Step into ABC Doors and Windows, where quality meets variety. Discover premium wooden, steel panel, fiberglass, and steel security doors alongside aluminum, UPVC, and steel windows designed for strength and durability. At ABC, we're always a better choice, delivering products built to last and service you can rely on. Visit our showroom at 1 Chanka Trace, El Socorro South, or call 638-7184 to make your dream home a reality.
Eye care tips for Seaview Optical. Eat well. Good eye health starts with the food on your plate. Nutrients like omega-3 fatty acids, lutein, zinc, and vitamin C and E might help ward off age-related vision problems. Quit smoking. Makes you more likely to get cataracts, damage to your optic nerve, and macular degeneration. If you have tried to kick the habit before only to start again, keep at it. Wear sunglasses. The right pair of shades will help protect your eyes from the sun's ultraviolet UV rays. Use safety eyewear. If you use hazardous or airborne materials on the job or at home, wear safety glasses or protective goggles. In every room, Vision sets the standard. For a limited time only, get your progressive transition lenses with an anti-reflective coating, designer frames, and eye exams. Starting at $16.50, only at Seaview Optical. Affordable eye care for everyone.
Many parents say, I get licks and I turn out fine. But did you really? Was that kind of discipline the most effective and helpful? Or did it instill fear and intimidation instead? Discipline is important, but it must be used in a constructive way with your children for it to be effective. So instead of just punishing them, also take the time to teach them what is appropriate behavior, to help them learn what to do differently and to make better decisions. Try to be in control of your emotions before disciplining them. And discipline should be fair and consistent. And most importantly, it should be appropriate for your child's age. Remember, spare the rod, it won't spoil the child. At the end of the day, keep trying your best. You and your children deserve it. Share if you found this useful and like and follow our profile for more parenting tips. The letter of the day is D for discipline.
It's giveaway time with the compliments of Joseph Sandel and the rest of his superb team at Great Health Works. So the numbers on the screen, we'd love to hear from you. And as a reminder, when you're patched into the studio, listen on your telephone rather than the TV set because there is a delay that creates confusion. So we're delving into the medical lexicon once more, and we're talking about hormones, the chemical messengers made by glands, usually transported into the bloodstream and exhibiting effects on these target organs or tissues. We know about things like thyroid hormone. We know about insulin produced by the pancreas, another type of hormone. And this evening our question is, which hormone is released during stress? So stress, anxiety, even depression we discussed, or sometimes you're writing an exam. It's also known affectionately as the fight or flight hormone. So you have some hormones which may be produced during stress. This one, the fight or flight hormone, specifically those little glands above the kidneys called the adrenal glands would be the source. That's the hormone we're looking for. The hormone released during stress and known as the fight or flight hormone, sometimes causing this nervousness, shaking, palpitations, and even a tremor. Let's go to the phone lines. Good evening and welcome to Ask the Doctor. Hello? Hello? So we're looking for the hormone. It sounds like we're having some technical issues, so it's an opportunity to see if you can call in for a prize with the compliments of Great Health Works. Which hormone released during times of stress and some clinical or medical situations is known as the fight or flight hormone. So you're trying to protect the body. So there is a protective role, and of course, in large amounts, it can be harmful. So the fight or flight hormone produced by the adrenal gland. And it's fascinating when we think about the way the body operates. Sometimes if it's produced in very large amounts, it can actually cause heart attacks, strokes, heart failure, damage to some of the blood vessels. Persons may have growths or tumors to that particular adrenal gland. And so levels of this hormone will be pouring into the bloodstream and some of the compounds associated with it. So let's try once more with the phone lines. Good evening and welcome to Ask the Doctor. Oh, it sounds like we might have to take a short break, so we will be affording you an opportunity to ponder it, look it up, give us a call when we return.
Love eating spicy food, but soon after, that familiar discomfort begins. Heartburn, acid reflux, and bloating. Introducing Peptica Gel, formulated with aluminum hydroxide, magnesium hydroxide, and simethicone to help neutralize excess acid. It's sugar-free with no chalky aftertaste and a pleasant orange flavor. Peptica Gel works fast to relieve heartburn, acid reflux, gas, and bloating, so you can feel comfortable again and get back to enjoying life. Peptica Gel, get the relief you need today. Available at pharmacies nationwide.
In today's fast-paced competitive job market, certification courses provide individuals with flexible and industry-relevant learning options. Increase your chances of employment with a certification course at CTS College. We have over 50 courses in business, IT, do-it-yourself or professional development to choose from, all developed by industry experts. Courses start as low as $200 and can be completed in as little as 1 day, allowing you to acquire the relevant skills you need quickly and affordably. Contact CTS College today to sign up.
I got a bone to pick with you. Ladies, I'm talking about that 90-day thing.
Well, so how that's bothering you?
Oh, but tell you how it's bothering me. I figure like this, ladies, if you're in your 20s, wait 90 days. If you're in your 30s, wait 60 days. If you're in your 40s, wait 30 days. But if you're over 50, jump on it.
Get the story first. Want to know what's happening in news, sports, or crime? Get the CNC3 app. As the story breaks, CNC3 is there giving you the story first on your mobile device. Be connected to the most trusted and reliable news source, CNC3. Access your world with just a tap. The CNC3 app. Download it today.
We must reopen the South Sea operation. There are tons of goodies to be released before the end of this month. And I expect your cooperation.
At the end of the month? But that's crazy.
In this business, there's only one way to solve your problems. If you don't do it, I will. Simple as that. I don't mind, really.
In Westwood Park, nothing stays hidden for long. Watch the drama unfold. Saturdays at 7:30 p.m. Only on CNC3.
Welcome back to the giveaway segments on CNC3 Ask the Doctor. That issue with the phone lines has been rectified. And as a reminder, let's have a look at that question again. Which hormone is released during stress and is known as the fight or flight hormone? Good evening and welcome to our show. Thank you for waiting.
Hello, good evening.
Hello.
The answer is cortisol.
Hello.
Yes, hello. Hello, good evening.
Hello, I'm not hearing you too clearly. Hello.
Hello, good evening.
Yes, welcome. Welcome to Ask the Doctor. Thank you for being part of our program.
You're very much welcome. The answer, the hormone is cortisol.
It is one of those stress hormones which would be made by the adrenal gland as well too, but it's fight or flight hormone. I will give you another chance because it starts with an A. Sometimes
adrenaline.
Adrenaline. So another one of those hormones. You are so right to do that they were all stress hormones, and that was what I was trying to quantify in terms of sweating, nervousness, palpitations. Congratulations, you're a winner. You've been reading about the adrenal glands, I see.
Yes.
Well done, and thank you for being part of our Ask the Doctor family.
You're very much welcome.
Have you used these supplements before?
No.
Okay, so there's a first time for everything, and stay on the line. We want to take some of your personal information off the air. So, wow. I'm glad that we were able to sort out those lines because, would you believe, there is a giveaway coming up after this break with the compliments of J.E. Guide Funeral Home, a $500 gift voucher for a spa for dear old dad in the month of June. Stay with us.
Some of us like to test limits, but there won't always be second chances. Obey the speed limits. Maybe you don't value your life, but others value theirs. A message from the TTPS.
Alejandro! What are you?
Don't miss the gripping drama Cabo. Sundays at 8 p.m. only on CNC3. Get the story first. Want to know what's happening in news, sports, or crime? Get the CNC3 app. As the story breaks, CNC3 is there giving you the story first on your mobile device. Be connected to the most trusted and reliable news source, CNC3. Access your world with just a tap. The CNC3 app. Download it today.
Name something that people stick their noses into.
The apple bucket, like bobbing for apples.
Where did that answer come from? In the apple bucket. Okay.
The excitement continues on CNC3's Ask the Doctor as we have another giveaway with the compliments of our friends from J.E. Guide Funeral Home at San Fernando or Princestown. And for a $500 spa gift voucher for dear old dad, and you can feel free to call in on his behalf. The question this evening is linked to blood vessels. Simple, sometimes there may be problems with this largest artery in the body that could be fatal. There may be swellings, the term is an aneurysm, there may be blockages or plaque forming there. Can you tell us the name of the largest artery in the body carrying oxygenated blood? Good evening and welcome to our show. Thank you for joining us.
Hi, good afternoon.
Welcome to Ask the Doctor. Thank you for being part of our family this evening. Do you have an answer to this question? What is the largest artery in the body? I'll give you.
Yes, I do.
Yes, go ahead.
The aorta.
Can you spell it for us?
A-O-R-T-A.
The aorta. Congratulations, sir. Yes, our first caller is also the winner in this segment. Well done.
Thank you.
So we want to take some of your personal information off the air, and once more, congratulations. Best wishes to you and the rest of the family. And we certainly want to hear more from you as the open forum is coming up next with more of your questions and hopefully answers. Stay with us.
Don't miss the gripping drama Cabo. Sundays at 8 p.m. only on CNC3.
Name something people stick their noses into.
I'm going to say into the oven.
This game is going to hell. Stick your nose in the oven.
Volleyball filmmakers
producers, content creators, influencers, and recording artists. If you're looking to rent a versatile studio space with green screen, video wall, cyclorama, and more, look no further. GM Labs is here to make your dreams a reality. Located in the heart of Port of Spain on St. Vincent Street, GM Labs is your one-stop shop for all your creative needs with over 2,800 square feet to work with. Take your creative concept to the final product at GM Labs. Give us a call or WhatsApp or message us on our Instagram and Facebook pages at GM Labs TT.
This is more than just music. This is where you find the best of TNT. This is more than just a vibe. This is where Bollywood gets a twist. This is more than just energy. This is Bhangra and indie pop too. This is the mix. This is the life. Lock on or log on now. Sangeet 106.1 FM. This is authentic East Indian radio. This is us.
When you hear that favorite theme music, you know we're live on Thursdays, which reruns on Friday at 11 a.m. or Saturday at 11:30 a.m. And this is your chance to call in with questions of a medical nature. It's the open forum. The number's on the screen, and as a reminder, listen on your telephone rather than the TV set. Our first caller is on the line. Good evening and welcome to Ask the Doctor.
Good night, Doctor.
Thank you for being part of our show. Welcome, ma'am.
Doctor, my left jaw is paining me whenever I yawn or whenever I eat. What's the cause of that?
Yes, ma'am. Thank you very much for taking the time to call in. It's a fascinating question, and sometimes it may be difficult to get a proper diagnosis just on the basis of a telephone call. People frequently may be referred to the dentist, so you're thinking about whether there is a problem affecting the gums or teeth. This week in the We Health section of The Guardian, we spoke about the role of looking after the oral cavity, the mouth, the gums, and all the structures within, because of the impact on the rest of the body. Sometimes there may be nerve involvement. Some people may find that a shooting, stabbing, or lancing pain may indicate, and this term is referred to as neuralgia. It's an old term, and it can be particularly unpleasant. There is a joint that is also found along the jaw called the temporomandibular joint, or TMJ, and there may be dysfunction or inflammation to that area. Persons sometimes may be prescribed basic drugs to reduce that inflammation, ranging from steroids or non-steroidal remedies. And of course, you would want to determine the underlying cause. There's an uncommon problem in some elderly people in which the artery by the temple may become thickened and tender, and it is associated not just with headaches or problems affecting the eyes, but there may be problems with chewing or pain to the jaw as an associated feature. That is called giant cell arthritis, or temporal arthritis is another term. So it's usually managed in conjunction with a primary care doctor and the eye specialist or ophthalmologist. So some of the reasons would be unclear. It can range from muscular or joint issues, the TMJ, temporomandibular joint dysfunction, or TMJ. It can range from dental problems, sometimes may radiate from nerve changes, and of course, very uncommonly, but worth thinking about, particularly in people over 60, giant cell or temporal arthritis can sometimes present like this. And not to minimize the fact that patients who have cardiac issues uncommonly may present with jaw pain, choking, sometimes pain down the arm. So it would be important to have a chat with your family doctor, get some basic blood tests on board, and then a prescription for some simple remedies, not just to alleviate pain, but to determine the underlying cause. As our next caller hails from the south, as Princestown is in the house. Good evening.
Good evening, Doctor.
Thank you for joining us, and welcome to our show.
Thank you.
Doctor, the drug that you use for diabetes, glycoside.
Yes, sir.
I want to know whether the glycoside has any.
It sounds like we lost our call. Our friend from Princestown, who is always well informed, that booming, distinctive voice. He was asking about medication which is prescribed for type 2 diabetes. We know that 90% of persons in the world will be battling this particular type of this scourge of diabetes. And glycoside is available on CDAP. It's one of the frequently used drugs to stimulate the release of insulin from the pancreas. Some of the side effects may range from weight gain to low blood sugar or hypoglycemia. So the doctors would want to also be using certain blood markers to determine the efficacy of this particular drug in conjunction perhaps with an agent such as metformin. Of course, as we stand in the threshold of the new millennium, and very much we're thinking about newer agents in the therapeutic armamentarium for diabetes, there are drugs which increase the excretion of sugar in the urine, but there are bonus effects in that they help the heart and protect the kidneys. There are some injectables every week. We've mentioned them on the show. Quite expensive, but play a role towards weight loss. You're battling obesity, you're controlling blood sugar, and also protecting organs, called the GLP-1 receptor agonists. And these have found actually first-line roles in the management of diabetes. Not to say that when we're thinking about drugs such as glycoside, we're looking at safety, tolerability, efficacy at an appropriate cost. Perhaps it's also time and a call for the ministry to re-examine some of the agents on CDAP, because as many of these newer agents go generic, it'd be time to make them available or accessible for the public. As we return to Princestown, good evening and welcome to our show. Hello.
Hi, good night, doctor.
Thank you for joining us, ma'am. Welcome.
Hi, yes. Could you explain the term vertigo for me, please, and the symptoms and what could be used?
Thank you very much, ma'am. And that's an excellent question. Such a common clinical conundrum. You would be surprised how many patients present to emergency rooms around the world battling this sudden sensation of the room spinning, sometimes associated with nausea, vomiting, sweating. That sensation that the entire room is closing in and occasionally may be linked to falls and fractures. Now, vertigo, or benign positional paroxysmal vertigo, is the commonest reason for this problem of the room spinning. It's shortened to BPPV, benign positional paroxysmal vertigo. The symptoms may be exacerbated if you move your head from side to side, if you bend to pick up an object. And there are certain calcium crystals or deposits that float in the inner air. So your doctor is unable to visualize if he or she were to look with a device. It is within the inner air but becomes shifted out of place. So there may be maneuvers to actually diagnose and to treat. If you're interested and you're on YouTube or Google, these are named after the gentleman who described in the management of BPPV, Hall-Pike's maneuver, or Epley maneuver, E-P-L-E-Y, and it involves sometimes changing the position of the head with the thinking that you can reposition the crystals. There are drugs which are available in the pharmacy and in conjunction with your family doctor to alleviate some of these clinical features of vertigo. So peripheral vertigo. Some people, there may be problems affecting the central nervous system or the brain, and it may present with features of vertigo, and those individuals, apart from basic tests, may need to consider a brain scan and consultation with a neurologist who's a specialist that deals with problems affecting the brain, spinal cord, and peripheral nerves. Our next caller hails from San Juan. Good evening. Welcome to Ask the Doctor.
Hi, good afternoon, doctor.
Pleasure to have you on the air, sir.
I'm calling to get some guidance and some advice on massive heart attacks.
Yes.
Because someone I know would have experienced one on Sunday.
Yes.
They had severe chest pain, they were vomiting, cold sweating, and when they went to the emergency, they confirmed through the tests that it was a massive heart attack, where they saw a clot to the heart as well. So if you could get some guidance on the recovery process, on what should be done and what should not be done after the suffering a massive heart attack.
Yes, sir. And thank you so much for taking the time to call in on their behalf, because cardiovascular disease remains one of the major issues affecting the world. In fact, it's the commonest cause for death when we think about medical problems and illnesses. And risk factors for a heart attack include diabetes, hypertension, high cholesterol, cigarette smoking, obesity, a sedentary lifestyle, a family history of heart disease, sometimes some chronic medical illnesses in which the antibodies are attacking and inflaming the arteries. So the watchword is prevention in someone who has suffered a heart attack. The medical term is a myocardial infarction. There must be aggressive control of all the risk factors I enumerated, because you don't want a subsequent event, particularly in the first few days. There are certain drugs which will be prescribed by the physicians to ensure that the likelihood of having a second event is minimized, ranging from so-called blood thinners, the humble aspirin. There's another one called clopidogrel, also recently added to CDAP, and statins that don't just lower cholesterol but also help to stabilize plaque in the arteries. If in the throes of a heart attack there are certain ECG changes and persons are admitted within 12 hours of symptoms like chest pain that radiates from the central part to the neck, the jaw, the left arm, and is associated with sweating, nausea, vomiting, dizziness, shortness of breath, fluid in the lungs. Within 12 hours, persons may sometimes have a special injection at the emergency room, a so-called clot buster, and the medical term is thrombolysis. However, a first world environment, which is what we must aspire to in Trinidad and Tobago, you're admitted to hospital in the throes of a heart attack, basic blood investigations, you're stabilized, you receive oxygen, you start your blood thinners, sometimes injections to also assist. Then you're rushed to a cardiac catheterization suite. You are rushed to have a test called an angiogram. That's actually to visualize where that blockage would have occurred. You heard in our question the major artery, but there are also different branches that supply blood to the heart, and there would have been a clot which would have broken off and created damage to that heart muscle. And there is a dictum when it comes to a heart attack: time is muscle. The longer you wait to have a look and to relieve that blockage, perhaps with a stent or to blow up a balloon called angioplasty, the longer you wait, the more that muscle in the heart is being starved of blood and oxygen. So in conjunction with the cardiologist, who's the heart specialist, there's a change in medications, control of risk factors that may have led to this heart attack, and you'd want to minimize the chance of another. An aggressive intervention would be the pillars for someone, at least in the initial stages of having this dreaded complication. Wow. Parting is always such sweet sorrow. Where does the hour go? And asked the doctor. Our closing quote, though, is from the classic poem Ulysses, Alfred Lord Tennyson, that poet laureate. And I thought it's a quote from his poem that's relevant to today: to strive, to seek, to find, and not to yield. In medicine, we see that spirit every day. We see it in patients recovering after serious illness, like a heart attack, a stroke. We see it in families supporting loved ones through difficult times. We see it in healthcare workers who continue to care with compassion despite long hours and great challenges. Whatever challenge you may be facing tonight, may these words remind you that progress is often made one small step at a time. Blessings to Reverend Winston Ramkissoon and his wife, Mrs. Vashti Ramkissoon, always locked into our show, and belated birthday wishes to Mr. Darian Karim from St. Madeleine. Thank you to all for trusting me to walk beside you each week, in your homes and in your hearts. To my team behind the lens at CNC3, to the intelligent Neil and baby Daniel, and to you, our viewers, stay strong, stay curious, and never, ever stop choosing kindness. Rest, reflect, and love deeply. God bless. We'll see you next week on Ask the Doctor.
You're watching CNC3.